Greetings from Yenepoya Dental College, Yenepoya University. I am Dr. Reshma Suvarna, Additional Professor, Department of Pediatric and Preventive Dentistry. So, resin infiltration is my topic for today, and resin infiltration is a minimally invasive technique which is used to treat white spot lesions or mild fluorosis or post-orthodontic discolorations or demineralizations. So, the SLO for today's topic is the students will be able to understand the rationale for using resin infiltration. Also, they will understand what kind of cases to be selected for resin infiltration, the concept of resin infiltration and the technique of application. Now, we all know that dental caries is a dynamic process of demineralization and remineralization. The fourth aspect of the caries triad, that is the tetrad, is the time concept, and that is nothing but the tilting of the scales between demineralization and remineralization. So, there are different areas in our mouth or the oral cavity on the hard tissues where areas of demineralization and remineralization will be happening, but this is all dependent upon what kind of environment the hard tissues are surrounded with. Now, the environment is dependent upon the factors such as our diet, the utilization of dental care facilities and the oral hygiene measures that we take. So, demineralization, which you can see here, is the process where calcium and phosphate are going out from the tooth into the oral environment. Basically, the tooth is losing the calcium and phosphorus and becoming more porous, whereas remineralization is opposite to it, where calcium and phosphate from the plaque or the saliva surrounding it is being taken into the tooth, thereby fortifying the tooth. So, we always want the scale to be tipped towards remineralization rather than demineralization. Now, when there is acid or increased acid content in the oral cavity or any part of the tooth structure, this results in carbonated hydroxyapatite enamel crystal, resulting in demineralization, which is partially dissolving type of crystal. Whereas, when there is increased fluoride or calcium and phosphate supersaturated in the saliva or the plaque, then remineralization process takes place. So, the fluoride in the plaque results in fluorapatite, which is a tough structure and does not break easily. This technique originates from the idea of infiltrating non-cavitated enamel caries with resin adhesives. Infiltration with mixtures containing smaller and less viscous resin monomers such as triethylene glycol dimethacrylate, also called as stegma, has proven to be better penetrating the lesions. Now, what is resin infiltration? Resin infiltration is a conservative, minimally invasive restorative technique used to arrest incipient carious lesions and treat white spot lesions aesthetically without the need for local anesthesia or mechanical removal of tooth structure. It is a low viscosity resin. Now, this is the product that we use or the material. It is the Icon resin infiltration material. Now, there are two types, the Icon resin infiltrant proximal and the Icon resin infiltrant smooth surface. The proximal is a specially developed hard tissue preserving treatment for incipient proximal lesions, whereas the smooth surface is a specially developed infiltration product for smooth surfaces, particularly well suited to remove the white spots and treat incipient caries, especially those related to orthodontic treatment. Indications: it's a micro-invasive treatment of non-cavitated dental enamel lesions, lesion depth up to D1. As you can see here, it can be treated up to D1 lesions, whereas D2 and D3 are contraindicated. Aesthetic improvement of non-cavitated lesions caused by demineralization and or mild to moderate fluorosis are also another indication. Now, why resin infiltration? It is excellent material for incipient caries or white spot lesion, enamel hypomineralization and enamel opacities. Also, it can be used with excellent results in mild fluorosis, iatrogenic effect after orthodontic treatment, etc. Now, there are certain contraindications for deep-seated lesions such as D2 and D3, as I had mentioned earlier. Then in case of known allergies to any material component or existing contact allergies. Also, it is contraindicated in root caries, cavitated tooth, erosive lesions and pit and fissure caries. What are the advantages of resin infiltration? This technique is highly accepted by patients as it is minimally invasive. It has improved aesthetic outcome as a masking resin on demineralized labial surfaces. There is no risk of post-op sensitivity and pulpal inflammation. The progression of the lesion is retarded and there is minimum risk of secondary caries. Also, obturation of porous, deeply mineralized areas, delay of restorative intervention for longer periods, mechanical stabilization of demineralized enamel, prevention of sound hard substance and permanent occlusion of superficial micropores and cavities. Now, what is the concept behind resin infiltration? As I told you, demineralization is particularly caused by the acid attack, which are mainly from the diet or the acid produced from the bacteria. Now, the acid that is produced will cause porosities in the outer surface of the enamel. So, as a result, the calcium and phosphate and other minerals tend to move out of the tooth, resulting in porosities. So, this is the onset of caries or the initial caries, as we say. Now, what does resin infiltration do? After icon, the pore system is closed. The pores that were present on the outer surface are completely closed. As a result, the acid gets deflected. The components of the system are, it has got three components: icon H, icon dry and icon infiltrant. The icon H is basically hydrochloric acid, whereas icon dry is 99% ethanol and icon infiltrant is methacrylate based resin matrix. So, the materials used are conducted in three steps. Step 1 is the H, step 2 is dry and step 3 is infiltrate. So, the technique for the proximal and smooth surface are the material that is included. It is unit which contains sufficient material for treating two proximal lesions, whereas the syringes included in the smooth surface kit, it has got sufficient material for treating 2 to 3 smooth surface lesions. So, the technique for the proximal lesion is clean the affected tooth and adjacent teeth, remove any cleaning residue with water spray, isolate and maintain dry field. Also, the teeth are separated with the separators or wedges. So, here we can see that the proximal areas are etched for 2 minutes with the etchant, and then it is thoroughly cleansed with the spray water for 30 seconds, following which the icon dry is applied and it is allowed to stay for 30 seconds. Following that, the final step is the placement of the icon infiltrant, which is placed for 3 minutes. In certain cases, it can be extended up to 6 minutes, following which the resin is cured for 40 seconds. So, in the smooth surface lesion, the light application of a medium grit abrasive disc can be utilized in cases of highly demineralized white spot lesions prior to etching. So, we apply the etchant similar to proximal lesions. We apply the etchant for 2 minutes on the smooth surface also. Then it is thoroughly dried, cleaned and dried for 30 seconds. Now, unless white spots are treated early, that is by 1 to 2 months after bracket removal, it is recommended to repeat the etching step up to 3 times. Now once the etchant is thoroughly dried for 30 seconds, then the icon dry is placed, it is allowed to dry for 30 seconds. On visual inspection, to ensure successful infiltration, the lesion must now be desiccated and inspected. In this step, a preview of the final result is shown. So when wetted with icon dry, the whitish opaque coloration on the etched enamel should diminish. If this is not the case, repeat the etching step. So once we feel the lesion is sufficiently diminished following icon dry, then we place the icon infiltrant, and it is placed for 3 minutes. In case of deeper and larger defects, the aesthetic result can be improved by extending the exposure time up to 6 minutes, following which it is light cured for 40 seconds. So the resin infiltration protocol is as follows: clean the affected tooth and rinse well, icon etch for 2 minutes, rinse with water and air dry for 30 seconds, apply icon dry for 30 seconds, apply icon infiltrant for 3 minutes, remove excess with cotton or with sharp explorer, light cure for 40 seconds. With a new tip, apply icon infiltrant again for 1 minute, remove excess with cotton or with sharp explorer, light cure for 40 seconds. Measure the shade after resin infiltration treatment. Now here are certain case reports. This is a case of management of white spots with resin infiltration. Here we can see that there is considerable success. However, certain amount of lesion is still visible. But if you see the next case, we can see that there is a white spot lesion here, and it's an opacity lesion in the incisal 1/3 of the central incisors. We have got considerably good result considering the opacity of the lesion. A good result is obtained with resin infiltration. This is another case of fluorosis where we can see that a good amount of lesion is corrected with the icon infiltrant. These are other two cases where the fluorosis case again has shown excellent result with resin infiltration, and this is post-orthodontic discoloration, also treated very well with resin infiltration. So these are the end results with resin infiltration. If done effectively, it can give excellent results. So certain polymerization inhibiting substances such as products containing eugenol must not be used in combination with this material, as it can hamper the polymerization. Now storage is store at 2 to 25 degrees Celsius and protect from direct sunlight. Do not use after expiration date. Here's a comparative evaluation of resin infiltration and fluoride varnish on the treatment of white spot lesion on permanent teeth, an in vivo study which was done by our own postgraduate from our department, and it was found that the resin infiltration had excellent result as compared to fluoride varnish. Here's a review of effect of resin infiltration on enamel. It's a systematic review and meta-analysis. The resin infiltration significantly changes surface roughness and micro hardness and shear bond strength in both sound enamel and white spot lesions according to this particular review. So what happens to the micro hardness? The resin infiltration cannot return the micro hardness of white spot lesions to that of sound enamel, although it may restore 68% of it. Shear bond strength decreases 25% in sound enamel but increases 89% in white spot lesions. Increasing the time of application of resin infiltration improves the depth of penetration. So this is in a nutshell about the icon caries infiltrant. As you can see, it treats up to D1 and not beyond that, and it has got smooth surface patient bags and proximal. Smooth surface may come up to 4 to 8 teeth and proximal for at least 2 teeth. It penetrates up to 1000 microns, and it is indicated in case of fluorosis, white spots, early proximal caries, and time of application is approximately around 30 to 60 minutes. So concluding, the resin infiltration is an efficient treatment for interproximal caries in adolescents and young adults. Also, it is an effective treatment for proximal caries. It doesn't cause significant adverse events or side effects. Resin infiltration increases the microhardness of initial enamel caries lesions. Also, resin infiltration may reduce the need for laminates or other full coverage restorations, which may take longer treatment periods as compared to resin infiltration, which may be done in a single sitting itself. So, these are the references. Thank you. Have a great day.